Namaskar. My name is Vinod Chandra and I am one of the founder members of the National Disaster Management Authority, Government of India. In this session, we would like to cover issues related to disaster mitigation and disaster preparedness, especially for healthcare professionals. We would actually be covering the definitions of disaster mitigation and disaster preparedness. We would also be highlighting some of the major disasters which India has faced in the recent past, and we would also look at illustrations of disaster mitigation and disaster preparedness. We would also be covering some aspects related to medical preparedness for improving the effectiveness of disaster management in our country. And finally, we would also provide a few selected references for further reading. Disaster has been defined as a catastrophe, mishap, calamity or a grave occurrence in any area arising from natural or man-made causes or by accident or negligence, which results in substantial loss of life or human suffering or damage to and destruction of property or damage to or degradation of environment, and is of such a nature and magnitude as to be beyond the coping capacity of the community of the affected area. This is the definition of disaster management, which is provided in the Disaster Management Act 2005. Disaster has been defined by the American Red Cross as an occurrence, either natural or man-made, that causes human suffering and creates human needs that victims cannot alleviate without assistance. So, normally there is a need for external agents to come in and then help the people affected by disasters, because they are overwhelmed by the impact of the disaster. The World Health Organization defines disaster as any occurrence that causes damage, ecological disruption, loss of human life or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. So, normally when a disaster actually occurs in an affected area, it is responded to by a lot of external actors. There are first responders like the Civil Defense and the Home Guards and the National Disaster Response Force and the Red Cross volunteers and so on, and the local communities are always seen as the first responders because they try to address the adverse impact of the disaster by trying to help people who are affected by the disaster. They help in search and rescue, evacuation, in setting up relief camps and so on. And disaster management is an overarching subject, which is a multidisciplinary specialization now, which is defined as a continuous and integrated process of planning, organizing, coordinating and implementing measures which are necessary or expedient for prevention of danger or threat of any disaster, mitigation or reduction of risk of any disaster or its severity or consequences, capacity building, preparedness to deal with any disaster, prompt response to any threatening disaster situation or disaster, assessing the severity or magnitude of the effects of any disaster, evacuation, rescue and relief, and rehabilitation and reconstruction. So, disaster management covers a whole multi-phase activities, starting with disaster preparedness, disaster emergency response, then disaster risk reduction or mitigation, and finally rehabilitation, reconstruction and recovery. So, disaster management can be understood as a cycle which has the upper half, which is the pre-disaster phase, and the lower half, which is the post-disaster phase. So, the upper half consists of two P's, prevention and preparedness, and the lower half, which is the post-disaster phase, consists of three R's, response, rehabilitation and recovery. In all the advanced countries, the pre-disaster phase activities, which are prevention and preparedness, actually is a very strong area, and so their response, rehabilitation and recovery after a disaster is actually a spontaneous and natural process, whereas in most of the developing countries we are very weak on the upper half, which is on prevention and preparedness, and because we are not adequately prepared, we are not able to respond to any disaster, and that we have seen in many of the major disasters which have happened in the past. We are not adequately prepared, and our risk reduction is also not sufficiently incorporating all aspects of disaster risk reduction in any development planning aspects, and so we find that we are not able to respond and recover effectively after any disaster. Disaster management is a continuum, so it actually goes through several phases. So we have the disaster preparedness and prevention, we have the capacity building, public awareness, which all happens in the pre-disaster phase, and then after a sudden occurrence of a disaster, it is the emergency response, mainly through search and rescue, evacuation, setting up relief camps, provision of relief supplies and various other aspects, and reconstruction and rehabilitation of the affected communities, especially if their houses have been destroyed, they provided temporary shelters, or they are actually also provided with permanent housing if their housing has to be provided because their houses have been totally destroyed. And the recovery is actually a process which actually takes place with the physical and social rehabilitation of the affected communities. The Government of India has actually seen that the national vision for disaster management, which has been defined, is to build a safe and disaster resilient India by developing a holistic, proactive, multi-disaster and technology driven strategy through a culture of prevention, mitigation, preparedness and effective response. This is the national vision which is enshrined in our national policy for disaster management, which was released by the Honorable Prime Minister in October 1999. And the national policy actually outlines this national vision, and we have been working to actually institutionalize this national vision through our efforts in improving disaster preparedness and also disaster risk reduction. I am sure that all of you must be familiar with some of the major disasters which India has seen in the last 15-20 years. I am sure that this Orissa super cyclone of 1999 was one of the most devastating disasters which India has seen, and in that super cyclone in 1999, Orissa lost more than 10,000 people and several lakh houses were destroyed and several lakhs of animals, more than 3.5 lakh animals were also destroyed due to the effect of the storm surge which had hit Orissa. In 2001, there was a disaster, there was an earthquake, a devastating earthquake in Bhuj in Gujarat on the 26th of January 2001. In 2004, on the 26th of December 2004, there was a devastating tsunami which India saw for the first time. A devastating tsunami struck Andaman and Nicobar and several parts of Tamil Nadu, Kerala, Andhra Pradesh and Puducherry. The Kashmir earthquake hit on September or October 2005. The Kosi floods hit Bihar in 2008. The floods were seen in Kashmir in 2010, which were very devastating. There was an earthquake in Sikkim in 2011, and the cyclone Phylin in Odisha in 2013 was also a very high intensity cyclone, but however, the damage was not as devastating as what happened in October 1999 in the Orissa super cyclone because of the early warning messages and alert and evacuation which was carried out in the coastal areas of Orissa. The Uttarakhand Cloudburst and Flash floods in 2013 were also equally devastating, and finally we also saw the Chennai floods in 2015. So some of these were actually very devastating major mega disasters. On the 26th of July 2005, we saw that there was a heavy urban flooding in Mumbai, and this was also accompanied by a high tide which actually brought in a lot of water into the highways and into the streets of Mumbai, and you saw that there were several thousands of vehicles which were actually trying to cross, and the flood levels were rising and people are coming back from offices, people are being traveling back from schools, children were being brought back from schools, and there were many people who were actually trapped in the vehicles because the water level started rising phenomenally. And because of the high tide and because of the unprecedented flow of water and the unprecedented rain which actually hit Mumbai on those days, 25th and 26th of July 2005, many people lost their lives because they were actually trapped in these vehicles. We have actually seen that there were also many other disasters which India has seen. The Kosi floods in 2008 is outstanding for the emergency response and evacuation which was actually carried out. The search and rescue was carried out. More than 100,000 people were evacuated in small boats like these, where 10 men or 30 men could be evacuated. So, large numbers of people, more than 1 lakh people evacuated in a period of about 10 to 12 days in such small boats, shows that there has been an enormous search and rescue and evacuation which was carried out by the National Disaster Response Force. One of the most important aspects of this kind of emergency response is also that waterborne diseases can be contained, and the outbreak of epidemics can be contained because of the deployment of medical teams. So, healthcare professionals have an important role to play, whether it is a flood, an earthquake, a cyclone or a tsunami. And we have seen that in the earthquakes in both in Gujarat in 2001 and Sikkim in 2011 and in Kashmir in 2005, there were a lot of people who were actually affected by the earthquake, but medical teams and provided a lot of help in terms of emergency medical support. Many people were actually had to go through emergency operations and emergency surgeries because earthquakes normally create a lot of injuries to the various organs, and then emergency surgeries have to be carried out. And we also saw that in the Uttarakhand Cloudburst and Flash floods in 2013, a lot of effort had to be carried out in terms of emergency search and rescue and evacuation, and large numbers of medical teams had to be deployed to ensure that the suffering of the people who were affected, not only because of the health reasons which they had to go through, but also because psychosocial care and trauma care for grieving people who lost their relatives had to be carried out. Now, many of these things actually show that there is a need for us to have a substantial effort in terms of strengthening our medical preparedness for such mass casualty events. The floods in Bihar in 2016, which happened very recently, actually show that 31 districts have been affected. 83.15 lakh people have been affected by these floods in 31 districts. 16.56 lakh people have been evacuated. And after we mentioned the Kosi floods in 2008, where 1 lakh people have been evacuated, the recent experience in the Orissa super cyclone, in the Orissa cyclone Phylin, was the evacuation of more than 1 million people, which is about 10 lakh people evacuated during the cyclone Phylin in 2013. But the floods in Bihar in 2016 evacuated more than 16.56 lakh people. 1,349 relief camps accommodated more than 9,87,000 people. 249 people lost their lives, but 327 cattle camps were also established by the government in various locations to attend to the cows and the livestock who needed fodder and also who needed safe drinking water and also various other support facilities. 1,149 medical teams were deployed in Bihar in all the affected districts to contain any potential outbreaks of waterborne diseases or epidemics. Now, all these show that there is this need for emergency medical preparedness for natural disasters in India. And then we come across this concept called mitigation. What does mitigation mean? Mitigation essentially means the permanent reduction of the risk of a disaster by minimizing the adverse impact of the disaster on the lives, livelihoods and property, assets and infrastructure. So, disaster mitigation is essentially disaster risk reduction to reduce the and minimize the adverse impact of any disaster on the lives, livelihoods, property, assets and infrastructure. So, we have to basically make sure that infrastructure, especially critical infrastructure like bridges, metros and railway tracks, railway bridges, flyovers etc. are built in such a way that they will not get adversely affected because of an earthquake or because of a flood. So, this is one of the main ways by which we can actually improve our critical infrastructure and make them withstand against natural disasters. Mitigation is also called disaster risk reduction, and it can be primary or secondary. Primary mitigation is reducing the hazard, vulnerability and exposure of the communities, and secondary mitigation is reducing the effects of the hazard. So, we can actually work with structural mitigation efforts or non-structural mitigation efforts. Structural measures are improving the capacity of property, assets and infrastructure to withstand the adverse impact of disasters. Now, this is actually done in many countries where you actually have the likelihood of disasters like earthquakes happening. Earthquake is a geological hazard, and in India more than 221 districts in 22 states in India are vulnerable to earthquakes. More than 59% of the country is prone to earthquakes because seismic activity has been happening in many of these areas. So, 59% of the country is prone to earthquakes, and so in such areas there is a need for ensuring that buildings are able to withstand earthquakes. So, there must be a capacity for not only buildings, but also for bridges, flyovers and for various other critical infrastructure including telecommunication, power installations, dams and other facilities also to withstand high intensity earthquakes. Structural mitigation measures are undertaken to improve the multi-hazard resilience of building stock, assets, property and infrastructure through measures like seismic strengthening, retrofitting, raising the plinth levels, constructing plinth and lintel bands etc. In the earthquake affected areas in Latur and Osmanabad in Maharashtra, we have seen that the reconstruction efforts actually carried out essentially using these plinth bands and lintel bands, and also retrofitting was done in the case of many of the amenities and facilities like government buildings, hospitals, schools etc. Structural measures also include the construction of embankments in flood prone areas, afforestation, mangroves and shelter belt plantations to reduce the wind speed of cyclones etc. Afforestation is also encouraged in areas which are prone to landslides. In landslide prone areas, the structural measures include the prevention of soil runoff through gully plugging, nala bunding and terracing etc. This actually help to conserve the soil from soil runoff, especially when there are high and unprecedented rain. Non-structural mitigation measures are essentially improving the multi-hazard resilience of communities to withstand the adverse impact of disasters through capacity building, public awareness, mock exercises and drills, scenario analysis and modeling etc. All these actually help in improving the capacity of disaster prone communities by creating greater awareness and also improved capacities to respond to disasters whenever disasters strike. The disaster mitigation efforts could also be through improved preparedness through closer monitoring, early warning and forecasting, last mile connectivity for dissemination of alert and early warning messages, use of electronic and print media, use of social media, community radio, FM radio etc. So, these days because of all this exposure to social media, there is a lot of immediate response which is happening. We have seen that during the Chennai floods in 2015, there has been a lot of public involvement and participation because of social media using Twitter and Facebook and various other social networking channels. Now we come to this concept of disaster preparedness. Disaster preparedness is defined as the state of readiness to deal with a threatening disaster situation or disaster and the effects thereof, as defined in the Disaster Management Act 2005. The improvements in preparedness is attempted through strengthening of the early warning systems, capacity building, public awareness, education and training of all stakeholder groups. In December 2004, when India faced the devastating tsunami, most of the adverse effects were largely because we had not received any early warning. And one of the decisions taken by the Government of India was to set up the Indian Ocean Early Warning System for tsunami early warning at the Indian National Center for Ocean Information Systems, INCOIS, in Hyderabad. And because of the establishment of the Indian Tsunami Early Warning System, we are actually able to provide early warning to tsunamis, and we hope that Government of India will be able to have both a federal response at the state level and also a central government response in the event of a tsunami next time. Disaster preparedness also includes creating a culture of prevention, improving the preparedness, and strengthening the emergency response capacities by setting up the National Disaster Response Force battalions, and also by establishing the State Disaster Response Force, by creating a culture of preparedness, by improving the involvement of communities through more and more volunteers working with the communities, and through a better rehabilitation and recovery. The capacity building of communities, especially in disaster prone areas, is done by involving the local communities. And India, it's important that we need to work with university students, college students, and also students in schools, because the median age in India is about 28 years, and so we have below the age of 35 years we have more than 600 million people, and so it is necessary that we need to strengthen the capacity building of disaster prone communities by involving youth and students in colleges and universities. It is also necessary for us to strengthen the public awareness of disaster prone communities by using modern communication tools and techniques and use of technology in the most sophisticated ways, as well as local level community radios, which can actually take the messages of the communities and understand the needs and demands of the local communities affected by disasters. Mock drills and exercises have to be carried out in all educational institutions like schools, colleges and universities and hospitals and government buildings and government offices, so that the communities are aware of what to do in the event of any disaster alert or early warning message which has reached them. So based on these experiences in mock drills and exercises, the people are actually able to improve their performance in the event of a sudden occurrence of a disaster. The National Disaster Response Force volunteers and also the local police and the NCC scouts and guides and various other institutions like the National Social Service in universities help in conducting these mock drills and exercises. We also have systems whereby we can set up the control and command centers, the National Emergency Operations Center at the national level in the Government of India, and also the state emergency operations centers at the state secretariats and the district emergency operations centers at the district levels, which are connected through various technologies including wireless and also internet, and VSAT through video conferencing to provide access to even disaster affected areas at the epicenter. In the district emergency operations centers, we have redundant communication links. These are multiple redundant communication links which starts with local telephones, but then you also have the facilities like communication links through wireless, ham radios and various other teleconferencing facilities, desktop printers, scanners and fax machines, audio and video conferencing facilities, and access to disaster support systems software and decision support systems, and disaster resource network databases via internet and intranet. You can actually have redundant voice, data and video conferencing links through multiple technologies, which can actually provide that even in the event of a sudden disruption of telecommunication, that either telephone lines get disrupted because of the collapse of telecommunication facilities, you can immediately restore that through the multiple redundant technologies. You also have transportable emergency operation centers, which can be airlifted and taken to the epicenter of any disaster, and so that immediate communication links can be established with the state headquarters, with the state emergency operations center, and also with the National Emergency Operations Center in Delhi. And there are also facilities for a conferencing facility inside these emergency operation centers, and they also operate with multiple communication channels, and they can also provide uplinks to conferencing facilities and through communication facilities to communicate whatever are the immediate needs of the disaster affected areas to the National Emergency Operations Center, and also provide video conferencing facilities and television uploads of whatever are the immediate felt needs from disaster affected areas. The emergency operations centers can be airlifted to the epicenter of the disaster, and they will be able to restore communication and provide the necessary uplinks to communicate effectively with other electronic media channels. The portable VSATs can be also taken for operations from a disaster site, and these are basically to help in establishing video conferencing facilities, and so that the various first responder agencies are having interoperable communication facilities, so that they will be able to communicate to the rest of the world in terms of the immediate needs of the disaster affected communities. And the portable systems can also be hooked up with interoperable communication facilities, so that the latest state of the art technologies are available into any affected area, and these can also be provided support facilities even if the power and telecommunication facilities are disrupted because of the disaster. And the Emergency Disaster Response Center is always very functional in the event of any disaster, and this becomes the coordination hub to provide better access to various facilities. And healthcare support facilities are also provided the better coordination because of such disaster response centers. And the information dissemination is actually conducted with multiple responder agencies as well as multiple responder institutions. Say for instance, if the district hospitals have to be linked up for emergency healthcare facilities and support facilities, private hospitals can be connected, blood banks can be connected, and ambulance services can be connected. All this coordination actually happens through a very efficient system of coordination and information dissemination through this kind of a hub which coordinates emergency response. And a disaster management information system actually brings all these multiple agencies together and coordinates both in terms of the demand as well as supplies. So whenever we have seen any disaster striking any area, the requirements of the local communities are actually documented through a process which is known as post-disaster needs assessment, and these post-disaster needs are actually then communicated to agencies which are actually helping in the emergency response. Say for instance, the private sector wants to contribute, so the corporate social responsibility actually now becomes a major focus, and the private sector can actually then be communicated what are the essential needs in these disaster affected areas, and they can work with the non-governmental organizations and other community based organizations in providing emergency relief. Communication and improving the public awareness on disaster management is actually extremely important, and this is one of the ways by which we can improve the emergency risk and vulnerability profiles and understanding on emergency risk and vulnerability profiles by local communities. So, the students and youth can actually play an extremely important role in creating public awareness through community radio, through FM radio, and also through other electronic and print media. And disaster management and disaster mitigation can be institutionalized in development planning, and that is very extremely important. Mainstreaming disaster mitigation in development planning has to be done by incorporating all new development projects and programs to necessarily have inbuilt disaster resilience. So, if you are building a new bridge or a new flyover in a flood prone area, you should actually be able to make sure that this new flyover or bridge is actually built to withstand the flood, or if it is an earthquake prone area, then it should be able to withstand an earthquake. So, all new development projects and programs will have to have disaster resilience built in, and the Planning Commission and the Ministry of Finance were to give approvals to the projects after verifying the compliance of disaster resilience self certification by the recommending official. In 2009, the Government of India, the Ministry of Finance issued directives that all new projects must be self certified in ensuring that disaster resilience is improved through higher specifications have been built in such proposals. Now, this is one way to make sure that in the event of any natural disaster, these development projects will not actually have the adverse impact. Ongoing projects have to be revisited to incorporate disaster resilience audit. In fact, in all advanced countries, disaster resilience audit is actually necessarily one of the aspects of development planning, and infrastructural loans would be sanctioned by the banks only after due diligence on disaster resilience audit of such projects. The Government of India had issued instructions through the Reserve Bank of India to all banks that large scale housing projects and infrastructural projects must be provided funding through bank loans only after disaster resilience has been ensured. Now, we have seen that emergency health response is necessary, emergency health preparedness is necessary for all disasters, because health is one of the sectors which actually comes into play in all major disasters. So, improving medical preparedness has to be done through strengthening pre-hospital emergency services. There has to be a necessary linkage to incident response system, through which we actually have the multiple coordinating agencies and the first responder agencies operate, and linkages to external medical services and search and rescue teams, and linkages to first responder agencies, blood banks and ambulance service providers. And this has to be ensured before any disaster, which means that basically we need to have such viable systems which can link to all the existing institutional mechanisms for effective coordination. The coordination between blood banks, hospitals and also ambulance providers before the event, so that when there is a sudden emergency, then all these institutional linkages can actually be brought into action. In the event of any major disaster, we will need to have the assessment of immediate health needs identified, and identification of medical and health resources. Who are the specialists in the area? Multidisciplinary specialists in various fields have to be identified, and temporary field treatment at the epicenter to save lives. And we have seen that whether it was the Bhuj earthquake in 2001 or the Kashmir earthquake in 2005 or the Indian Ocean tsunami in 2004, we had to have the emergency health services operate from the epicenters of such disasters. So, immediate healthcare services, emergency healthcare has to be provided at the epicenter, and then people have to be shifted to the hospitals. And so, healthcare professionals need to understand triage. They need to know what are the color coding of mass casualty events when there are large numbers of people who are affected by disasters. Red is a high priority, yellow is a medium priority, and green refers to ambulatory patients who need to be provided immediate medical help by taking them to the hospitals through ambulances, and black is the color code for the dead bodies. And this kind of color coding of mass casualty events also need to be followed in the event when there are large numbers of people affected. We have seen that in the event of major disasters where thousands of people are affected and there are large numbers of casualties, then we will need to actually have these kind of systems which are necessary to be followed. Strengthening medical preparedness can be done by developing a directory of medical and public health resources at the national level, at the state level, and at the district levels. It's very much necessary that we need to create such directories. Creating a directory of multidisciplinary specialists in various fields of medicine, identifying the resources in the private sector, preparing a medical preparedness plan with surge capacities identified in advance. So, for instance, if there is a sudden air crash in any of the airports or near any of the airports in any of the mega cities or even any large city, is the district hospital in a position to provide such immediate support for surge capacity for patients who are actually being brought in the event of a major emergency. So, we need to know whether we can actually have a medical preparedness plan with surge capacities where we can actually have new wards created immediately, emergency wards created, and large numbers of people can be actually attended to. Multidisciplinary specialists can be called in on such emergencies. Strengthening the medical preparedness for mass casualty incidents, and also by doing exercises by developing the worst case scenarios. If you are actually successful in handling a worst case scenario, then when a major emergency strikes, then you will be much better prepared, because our experiences will actually teach us better. Safety of food and drinking water in the relief camps is extremely important. The control of mosquitoes and rodents are important because many vector-borne diseases actually happen. Disposal of dead bodies and animal carcasses to prevent outbreak of diseases, and addressing psychosocial care and trauma of disaster affected people. And these are some of the larger concerns of medical preparedness in disasters. Sewage disposal and waste management is extremely important. We need to also have gender segregated toilets. We need to have separate toilets for women and separate toilets for men, and we must also have adequate water facilities in these toilets. Prevention of outbreak of waterborne diseases is extremely important. Grievance handling and conflict resolution, so that people are actually able to express if there are any complaints or any grievances, they can be addressed. And more effective information management, transparency and accountability. These are all the hallmarks of very improved and effective disaster management, and we hope that these will also be addressed. Now, when the Gujarat earthquake happened in 2001, many of the hospitals and health facilities collapsed, and we have seen that not only in Gujarat in 2001, we have seen that in the case of the Sichuan earthquake in China in 2008. We saw that in the case of the earthquakes in Istanbul, in Turkey. We saw that also in the case of the Bam earthquake in Iran, and many such major disasters, major earthquakes. Hospitals and health facilities get damaged during earthquakes, and the Bhuj Hospital has now become a very sophisticated hospital because of the support from the Prime Minister's Relief Fund, and it has actually become a hospital with a base isolation, and this actually shows that we need to have such advanced hospital facilities which can withstand earthquakes, because in the Bhuj earthquake in 2001, many doctors and patients and bystanders died when the earthquake happened in the Bhuj Hospital because of the collapse of certain wards where hospital doctors and patients and bystanders died. And these are instances which actually show that health facilities have to be multi-hazard resilient. And for advanced reading, we have a few references which are mentioned here. It will be useful to look at the website of the National Disaster Management Authority, www.ndma.gov.in, and the Government of India, the National Disaster Management Authority, has released several guidelines on psychosocial support and mental health care, on management of biological disasters, on nuclear and radiological emergencies, on management of dead in the aftermath of a disaster, management of earthquakes, management of tsunamis, and guidelines on threats to municipal water supply and water reservoirs, and so on. Many such documents are available, and we hope that through creating greater awareness on health requirements and health needs in emergencies and natural disasters, we will actually be able to be better prepared, and we will be able to reduce the risk from natural disasters. Thank you.